Okay, now today we will talk about sign and symptoms of hydrocephalus in different age group of patients, right? Symptoms of presentations depends on the age of the patient, duration of onset and site of obstruction and the pathology or cause of obstruction, right? If acute onset, then severe headache, patient will show nausea, projectile vomiting, unconsciousness, pulmonary aspiration or pulmonary edema, brainstem herniation, cardiorespiratory arrest that will lead to death ultimately. And if there is slow onset hydrocephalus, then there will be enlarged head circumference, poor feeding, vomiting, headache, delayed milestone, irritability, confusion, lethargy, weakness, unsteady gait, seizures, bladder incontinence or impaired cognition, bulging fontanelle, and cranial nerve palsies. Symptoms that is common in all age groups are headache, nausea, vomiting, and seizures. Then what are the signs of hydrocephalus? Enlargement of head circumference or prominent large head, widening of sutures, bulging fontanelle, poor head control because of the large head, McEwan sign, setting sun sign, papilledema, and signs of raised ICP will be seen like frontal bossing, dilated scalp vein, and cranial nerve palsy. In cranial nerve, sixth nerve palsy, that is called false localizing sign, 10th nerve, that is vagus nerve palsy cause vocal cord palsy. Second nerve, it is optic nerve, which can lead to cortical blindness. Third is oculomotor cranial nerve, it will lead to diplopia and dilated pupil. Along with that, there may be Cushing triad, bradycardia, hypertension and irregular breathing. Along with that, seizures, confusion, decreased consciousness to unconsciousness may be seen. Pulmonary aspirations is common because there is vomiting, repeated vomiting is there. Signs of the cause, like if there is tumor, then signs and symptoms of tumors will be seen. Tuberculosis, subarachnoid hemorrhage, and as we all know that hydrocephalus is associated with the many congenital anomalies. So there will be congenital syndromic features may be present, and we all know vectoral group of anomaly. Vectoral means vertebral, anal, cardiac or cleft lip, tracheoesophageal fistula, E for esophageal atresia, R for renal, L for limb, and H for hydrocephalus. So particularly we are talking about infant and hydrocephalus. So in continuity, we will see the sign and symptoms in infant. The most prominent sign is unusually large head, a rapid increase in the head size, poor head control, frontal bossing, bulging and tense fontanelles, prominent scalp vein, poor feeding, lethargy, delayed milestone, vomiting, nausea, irritability, seizures, sleepiness, lower limb, increased spasticity. So, what is sunset sign? The sunset sign in which there is upward gaze palsy means like when sun is setting, the lower margin of sun is covered by the sea. It is not seen, right? Like this is visible in this picture also. And similar to the setting sun, baby's eyes are seen. The lower sclera or lower pupil is not visible. It is covered by the lower eyelid. Only upper sclera is visible. The baby is unable to move his or her eyes upward. So it is also called as upward gaze palsy. And this setting sun sign not only present in hydrocephalus, but it is also a sign of shunt dysfunction, and it is basically the cause of setting sun sign is dorsal midbrain compression, and it is the earliest sign of hydrocephalus before enlarged head circumference and full fontanelle. And fontanelles are also called a soft spot of baby's head. This picture is showing abnormal head circumference, and There are two fontanelles. One is anterior fontanelle and the posterior fontanelle. Anterior fontanelle is kite-shaped or diamond-shaped, while the posterior fontanelle, as picture shown, is triangular in shape. The anterior fontanelle closes around the age of 11 to 18 months, and the posterior fontanelle closes around the age of 2 to 3 months. But in hydrocephalus, there is suture diastasis, and that will cause bulging fontanelles because of the raised ICP. And the third picture, we can see there is dilated scalp vein and frontal bossing in the baby. What is McEwan sign? McEwan sign is called as crackpot sign, and on percussing the cranium over the cranium, there is resonant sound is produced. This sound is like crackpot sound. That's why it is called as crackpot sign. Uh, Under cranial nerve palsies, the most common is lateral or abducent nerve palsy. It is also called as horizontal gaze palsy and false localizing sign. This sixth cranial nerve, abducent nerve, is actually responsible for ipsilateral eye abduction. And because of the raised ICP and because this nerve has longest course intracranially, so this rendered this nerve sensitive to pressure, and it is very commonly involved with the Arnold-Chiari malformation. And what is Arnold-Chiari malformation? There is actually caudal displacement of cerebellar vermis, fourth ventricle and lower brainstem below the foramen magnum. Okay, so this nerve can be involved. And as already told you that vagus nerve is involved, then there is a stridor because bilateral vocal cord palsy is there. This is due to stretching of 10th nerve of vagus nerve over the lip of jugular foramina. If optic nerve involved, then there is cortical blindness, and in fundoscopy we can see papilledema, which we know because of the raised ICP. Stretching and compression of medulla midbrain leads to irregular respiration and apnea. One important note is there. Average head circumference in newborn is 34 to 35 centimeter, and chest circumference is 2 centimeter lesser than head circumference in newborn. But because of the large head, the difference between the head and chest circumference, which is normally less than 2 centimeter, it is increased. So what are the signs and symptoms in older children and adults? Because they have rigid cranial cavity, so the signs of raised ICP will be prominent. We will see the Cushing triad and nausea, vomiting, headache, lethargy, blurring of vision due to papilledema, failure of upward gaze, sixth nerve palsy, gait disturbances, irritability, and seizures. Uh, when we look X-ray skull in older children and adults, it will show beaten silver or copper cranium appearance, atrophy of brain adjacent to the enlarged ventricle because the enlarged ventricle they compress adjacent cerebrum. Normal pressure hydrocephalus, the ventricles are enlarged and there is normal or high normal intracranial pressure. Normal pressure hydrocephalus commonly seen in elderly, and there is Hakim's triad. Gait disturbances, difficulty walking, cognitive impairment called dementia, and urinary incontinence. Okay, this is for today's class, and in next class we will talk about investigations, preoperative optimization if required, and the PAC or examination and the treatment part of the hydrocephalus. Thank you.